Safer eating and drinking. Practical tips for carers and people who support someone with their mealtime. What information can you find out? Introduction. Some words to be familiar with. 40 seconds. What do we need to do first? Mouth care, posture, movement, and pacing. 1 minute and 56 seconds. Checking food consistency. 4 minutes and 29 seconds. How to thicken drinks. 5 minutes and 30 seconds. Swallowing recommendations. 6 minutes and 48 seconds.
Hi, I'm Jo from your local Adult Learning Disability Speech and Language Therapy team. Speech therapists help people when they have difficulties with eating and swallowing their food and drink. In this video, you will learn about some practical things that you can use to help someone have a safer meal, drink, or snack time. Some words to be familiar with. Dysphagia means a problem with swallowing. Aspiration pneumonia is a chest infection caused by something you swallow, such as food or drink, going down the wrong way and into the lungs. Dysphagia and aspiration pneumonia are more common in people with a learning disability. IDSI stands for International Dysphagia Diet Standardization Initiative and is the framework used to describe the different textures of food and drink. Having a difficulty with eating, drinking, or swallowing can be a worry, but there are things you can do to help stop someone becoming ill, which we will now show you. This video does not replace attending specific dysphagia training. If you have any questions, please contact your local speech and language therapy team. What do we need to do first? Mouth care. Keeping a person's mouth clean and healthy is good for their overall health, and also helps stop germs going into their lungs. You should check the person's mouth is clean before they eat. Check their mouth is clear of food after meals and before lying down or moving around. Movement. Make time to look after their chest health. Doing exercises or moving around can help to keep their lungs working well.
Your local speech and language therapy team can give more information, but additional resources can also be found here. www.keepingmychesthealthy.nhs.uk/how-can-I-chest-healthy.
Posture. The swallow works best when a person is sitting upright and their posture is well supported. When we sit upright, our swallow is stronger and it helps the food to go down the right way. Pacing. Make sure there is time to enjoy the meal and concentrate on eating and drinking. Make sure the person finishes what's in their mouth before they take their next mouthful, encouraging them to take a breath between each mouthful. Make sure they don't have too much in their mouth at once. Having too much food in your mouth makes it hard to chew and swallow.
Your local speech and language therapy team can give more information about general mealtime support, but additional resources can also be found here. bit.ly/help-stop-choking. bit.ly/dysphagia-diamond-standards-resources.
After you've considered mouth care, movement, posture and pacing, your speech therapist might recommend changing the texture of your food and drink. This may make the food easier to chew or make the drink move slower, which can help some people swallow more safely. Let's show you how to check the food consistency and make a thickened drink. Checking food consistency. A speech therapist may recommend an IDSI Level 7 Easy Chew diet or an IDSI Level 6 Soft and Bite-sized diet. How do we know if these foods are soft or easy to chew? When we talk about soft food, the food should pass the fork pressure test. The fork pressure test means that when you push down on a piece of food with a fork, by applying pressure so that your thumbnail turns white, The food squashes and remains squashed. If the food doesn't squash or it bounces back, it means it is not soft enough. Some people need an IDSI level 4 puree diet or IDSI level 3 liquidized diet. These diets should be completely smooth. There should be no lumps in either an IDSI level 4 puree or IDSI level 3 liquidized meal. How to thicken drinks. A speech therapist might recommend some thickening powder to add to the person's drink to make them move slower. The speech therapist will tell you what IDSI level drinks the person needs. Please follow the instructions given by the thickening powder manufacturer about how many scoops are needed of their product to get the right thickness. Put the correct number of level scoops into a dry, clean cup. In a jug, measure out 200 ml of the chosen drink. Add this drink to the cup with the thickener in it. Shake or stir well. Leave the drink to settle for at least 1 minute. Check the drink is the right consistency. Please note that some drinks may thicken at a different rate. Please ask your local speech and language therapy team about this for more help. If you need to make more drink, make another 200 ml of drink. Avoid guessing or making up different quantities. Telling other people about your swallowing recommendations. Please share this video with your colleagues and any others who might be supporting someone with an eating and drinking difficulty. It is part of your responsibility to ensure that eating and drinking recommendations are always to hand. Adding them to hospital passports and sharing them with every setting the person accesses, such as respite or day opportunity services. When you tell other people about the eating and drinking recommendations, it's important to be accurate. It is essential that you use the specific words given to you by the speech therapist to describe the food consistency. For example, IDSI level 6 soft and bite-sized diet.
These are not official IDSI resources, educational materials, or education programs, and they are not meant to replace materials and resources on www.idsi.org. For more information, please speak to your local speech and language therapy team, including to make a referral, or visit Dental Healthcare www.nhsteamsmile.co.uk. IDSI level food testing www.bit.ly/IDSI-food testing. Chest health www.bit.ly/how-can-I-keep-my-chest-healthy. Dysphagia diamond standards www.bit.ly/dysphagia-diamond-standards. Help stop choking www.bit.ly/help-stop-choking. This video was made in co-production with the Speech and Language Therapy team from NHS East Suffolk and North Essex NHS Foundation Trust, ACE Anglia, and NHS Suffolk and North East Essex.